Our noon discussion on the Rocky Horror Picture Show, right? Infamous case study. Where would the group like to start? It's amazing how a group this big can make zero eye contact with any other person in the room when that question is asked.
That's sad.
Dr. Frankenfooter? All right. What did you observe?
He's a narcissist.
How so?
I don't know, he just thinks that, he's like, this is, his world, everything involved, and, he just, he keeps trying to manipulate everybody for his advantage and for his fantasies and everything.
Mm-hmm.
He has people call him master.
You what?
Yeah, so.
It's a cult, that's why I think.
For those who are preparing for a shelf exam tomorrow, the narcissistic personality does adhere to a single cardinal trait, which makes studying for this condition or identifying this condition on a shelf exam easier. What is that trait? Once you identify the trait of the cardinal feature, the diagnostic criteria are no longer criteria. They're just examples of that cardinal feature. So, best way to approach all the personality disorders, and this one we'll put in that proverbial column A, does adhere to a cardinal feature, which is
Empathy related?
lack of empathy.
Yeah.
It's part of it, definitely.
That's antisocial.
Also part of it. They cluster. Arrogant, haughty behavior, and that belief that they are special. And then the underwriting is they could only be understood by people as special as they are. That's it. And then every single criteria is just an example of that. Because the text then reads as evidenced by blank number of the following. And you'll never have to know that number needed to diagnose, not for a shelf exam. All right. Is Dr. Frankenfooter arrogant, haughty? Do they believe they're special and therefore can be understood by only people as special as they are? I got a quick nod. So sure. All right. We'll certainly include that in a differential then. For purposes of studying, for instance, for a shelf exam, what are the other conditions listed in the same cluster of personality disorders beyond the narcissistic personality disorder? Histrionic personality disorder. Somebody give me the antisocial and one more. Borderline personality. All right, so give me the cardinal feature of each so that our third-year clerks are well prepared to identify this on a shelf exam within the next 24 hours.
So for antisocial, there's violation of others' rights.
Perfect.
Deceit, impulsivity, lack of empathy, and past history of such behavior before the age of 12, 15?
15. Yeah. That last part is written in the text. Conduct, yeah. But the cardinal features, you nailed it, right? That blatant disregard for and violation of others' rights. That's it. And then the 9 criteria, there are 9 examples now that will make it so much easier to identify on a standardized exam. 2 more conditions with their cardinal features if they have them. That's a hint, by the way. Borderline personality, and you just told me the one that does not adhere to that cardinal feature, unfortunately, which means, and it's not beyond the scope of this discussion. We have to talk about borderline a little bit more depth to prepare for the exam, to review for the exam. So this is the one that is the outlier. And I think we've reviewed this already, but it's always a good idea to review again. One of the things that we could do to review the diagnostic criteria for borderline personality disorder is to identify what the 4-part definition of a personality is in the first place, right? So I know we have undergraduates here, so we're going to tread very carefully that we're not going to go by way of Freud, Jung, Erik Erikson, because we could spend the entire week discussing with personality, well, actually, semester, of what a personality is. Any theorist has their own chapter. The good news here is that the APA has by far the simplest definition in that a personality includes 4 domains. What are those 4 domains as per the APA? think you mentioned one already.
I don't know like the exact ones, but that the chronicity, it's being present for like almost all their lives. It's present across multiple domains, not just specific to one situation or one area of their life. It's like pervasive, I guess.
Right. Everything you said is true. We're still looking for the 4-part definition now. Like, what is it that is pervasive and stable?
Behavior or
Not behavior.
Relationships.
Yes, interpersonal functioning. One of the 4. 3 more? Cognition. Right. The deficit would be, do they interpret their stimuli through a negative filter? Right. Are they the type of person to complain to you that their Mercedes is in the shop yet again? Right? Cringy. Right?
So are these things that are not modifiable?
They're modifiable.
Okay.
Psychotherapy.
Okay.
2 more. Impulsivity. Right. And 1 more?
React.
Yeah, good. Affective instability. Right? So those are the 4 parts, the 4 domains. For someone to rule in for the general definition of a personality disorder, they must demonstrate deficits in 2 of those 4 domains. And it must be clinically significant and then related to the other criteria, the other parts of the definition that you mentioned, right? All right, so getting back to borderline personality, the authors of the DSM incorporated 2 of the 4 domains, that is, parts of the definition of the general personality as part of the definition of borderline personality as well. So what are the 2 that carry over and are actually listed in the symptom set, the criteria set for borderline?
impulsivity, reactivity.
And? Actually, I'm sorry, I take it, there's 3. That's right, and 1 more. Good, right? So affective instability, interpersonal dysfunction, and that's beyond being clinically significant, right? And impulsivity. 3 of the 4 are actually contained in a specific definition of borderline personality. So a little bit of redundancy there, but you're now 3. I think you need 5 total, so you're literally 60% there. To add to this growing list, we could look at different defense mechanisms, and there are 3 that are characteristic of borderline, and those 3 link directly to clinical criteria. Right? Splitting results in what behavior that is listed as a diagnostic criteria?
Interpersonal.
It's definitely related to that. It's more affective instability, right? Which you've already mentioned because it's part of the general definition. So we're still stuck at 3, even though it's good review. 2 more characteristic defenses.
Acting out, maybe?
Very close. It's actually acting in a condition.
Harm.
Yeah, you read my mind. Yeah, so self-harm is the criteria. I don't think you'll be asked the defense, but listen, it's fair. It's called passive aggression, and it's the direct opposite of acting out. It's when a person internalizes a nihilistic impulse such as anger. Oh, by the way, that's also a diagnostic criteria. And then one other, one additional defense mechanism that is very characteristic is dissociation, which happens to be a criteria in and of itself, right? So if you include anger, I think we reviewed 6 or 7 of the total of 9/10. So you've gotten most of borderline down, despite the fact that it does not have a cardinal feature. And then finally, there's one more cluster B personality we have not yet named, right? And it does have a cardinal feature, which is?
Emotional display,
Okay.
harm, and flirtatious behavior.
Mm-hmm. So the individual needs to be the center of attention. Okay. Any questions about this incredibly ultra quick and rapid review of the cluster B personality disorders?
What do you think? So, if these are elements of personality that are pervasive and stable across time, what do you think? How is that explained by the relationship between borderline personality disorder and significant childhood ACEs or ACEs implies childhood?
I think early childhood experiences, in general, will significantly influence adult personality and therefore adult personality disorders. That's number 1, right? And you know what? what I think the medical literature demonstrates is that there are specific experiences that could be, what's the word I'm looking for, reliable and predictive of the particular behaviors and therefore a constellation of traits, hence personality disorders, right? So early childhood sexual abuse has that direct linkage, not 100% of the time by any stretch, but what happens to a person when they are sexually violated when they're a child is so consistent and reliable that we can actually package what we are likely to see years later, decades later, and name that package borderline personality disorder, which itself is probably a variant of PTSD. Similarly, there is evidence in the literature to suggest that people with early onset diabetes, juvenile onset or type 1 diabetes, do tend to have a personality development that is very reliable. And there, the constellation of behaviors and feelings all seem to be consistent with what we label dependent personality disorder. Okay, so that's in the medical literature. I don't think it'll come up on your exam, but I don't know if that addresses your question.
Thank you.
Other thoughts about,
Yeah, I was like, I wanted to ask about Brad and Janet. By the way, Dr. T, I hate musicals. This was a torture for me.
Come on.
20 minutes and 3 songs already. But yeah, I just noticed that when they did arrive at the place, that the whole time, obviously, Janet was more scared, and then Brad's behavior, he wasn't more scared, he was curious, saying, oh, it's probably their culture, and it was played off. They were saying, oh, Brad is a manly man, and part of me thinks, is Brad being a manly protective man, or is Brad enjoying the show? Because I thought he was enjoying it, if anything. I don't know if he was being protector. He was looking around the whole time, even when they took off their clothes. His reaction was not like Janet. Janet's, I think, is normal. I'd be freaking out too, but he was more curious. Do you think he's attracted to that stuff, or is that the manly front of, oh, I have to be the not scared one?
Brad's behavior is definitely complicated. Janet, as you pointed out, I think is a little bit more textbook. This movie is a coming of age movie. When you look at the movie through the perspective of the main female character, the Janet Weiss that we see in the beginning of this movie is much different than the Janet Weiss we see at the conclusion of this film. She has come of age. We could talk about how her experience has chipped away at what seems to be a very austere and stern superego, and that she has a lot of her impulses come to the surface, come to conscious awareness that she then acts on and is quite content with. Right? It's a coming-of-age movie for this woman. Right? So we could talk. I made a conscious effort not to talk about Jung and Freud and getting at the diagnoses of personality disorders, keeping it simple, keeping it to the APA definition. However, there's a lot of personality discussion to have when we look at the two main characters, or two of the three main characters, and that conversation can start with Janet. Right? And that is the ego and the superego. Again, not likely to see a lot of this on your shelf exam, but it is fair game. Not really sure if Brad allows for as direct and discreet a discussion, Freud or otherwise, in terms of what's going on with him. He does, I think the words he uses in the beginning, let's play along. I don't know if that is a hypothalamic fight or flight, that he feels that if he fights, he could meet with imminent demise, and therefore it's a fear response. That could be part of it. But his character is not, I don't think, at least my initial impression, is not as straightforward as the personality development, the character development of Janet. Anything else with Brad and Janet that you noticed you want to talk about?
Well, going on that, sorry,
You go first.
just that Janet was the first one to participate in. She started singing, I don't know if you remember, and he looked at her mortified and nudged her to stop. So I think it's kind of complicated that maybe he, like what you're saying, wants to be protective, but I also don't know that he was the first one to. I don't know if I would say he was the first one to enjoy it, because then she was the first one to participate. It's probably this complicated understanding.
You know, her again being impulsive and singing and him nudging her might be consistent with the idea that he is playing along so as to avert imminent demise. I don't know if Dr. Frankenfooter doesn't make the face that they make, whether Brad nudges her or is otherwise concerned. I think he picks up on the tenor of the room. I think he sees the expression in his host and realizes she can't do that. Otherwise, we're going to be in bigger trouble. So it might be consistent with at least one of our original thoughts. And again, so while Janet, getting back to your initial impression, while Janet maybe allows for an in-depth discussion of personality theory, starting with Sigmund Freud, and the psychological aspect of human behavior, maybe her fiance, maybe Brad's behavior is more consistent or more in line with the discussion of the biological antecedents, specifically the hypothalamic reaction to fear.
Wasn't her maybe her reaction to Bruce, the monster Frank, wasn't it a bit normal because he's supposed to be the perfect man or whatever, you know what I mean? So I feel like her attraction to him wasn't that insane. Even though she was with Brad, he's supposed to be like everything you want in a man.
I wouldn't use the word insane to describe her either. And if it, again, on the id level, it's natural. On a superego level, she does defy cultural norms in that she is engaged. So again, we can talk about Freudian theory, the id's pleasure principle, that connects her with Rocky. But there's also the superego's reality principle, which says that there's a violation of social conduct here, in as much as she's wearing his ring. It's hers now, but...
Well, Brad did it too, so it's like fair game for her.
Oh, listen, Brad's got his own stuff going on, no doubt. But the discussion of Freud and Freudian theory and the id versus the superego is certainly something we can actually review when it comes to Janet's development, character development.
Like some version of Stockholm Syndrome in Janet.
Could be Stockholm Syndrome, right? She,
Shock
again,
bonding.
at a subconscious level, she could understand that if she doesn't play along, I mean, she's taken a cue from, it was her fiance that first brought it up, that there might be more harm than benefit. Other observations, other characters, the Rocky Horror Picture Show.
With like Frank, I just wanted to mention earlier, his like sexual disinhibition, grandiose delusions, aggression. We could also like have bipolar on the differential as a manic episode.
Yep. That absolutely has got to be part of the conversation. Their speech is coherent, elucidated, and otherwise not rapid. I don't get any evidence of flood of ideas or elusive associations, although we could talk about psychosis. Right. What percentage of individuals with bipolar 1 will experience a psychotic episode during their lifetime? 50%. And that compares to about 10 to 20 for major depressive disorder. Right. So the other thing you'd have liked to seen in this movie that would have been, again, consistent with the medical literature is that there's some evidence of substance use. Because about 60% of individuals with bipolar 1 will have a co-occurring substance use disorder. So that would have been nice.
I think with Delta Cluster B, substance use is very comorbid.
Yeah. Mm-hmm. Yeah. So again, if they wanted to go back and rewrite some of the script, maybe, not to say that there isn't, but if there is, it's definitely off stage or out of script.
Do you think schizotypal would be a differential also?
Yeah, I mean, it depends on where, and now we're painting a continuum where we actually land when it comes to the main character. So we know that schizotypal personality disorder is a significant risk factor, a psychological predisposing factor to develop a future psychotic disorder like schizophrenia. So that's got to be in our differential too. If you think that there's truly frank psychosis, pardon the pun, they may have a co-occurring personality disorder, but its role is in the etiology. You wouldn't necessarily address it in treatment in as much as you really want to make the psychosis the focus of your clinical attention. So, yeah, Yeah. Now let me ask: do you think Dr. Frankenfooter is psychotic? Because if so, maybe the prequel to this, which by the way would be awesome if it were made, would I think have the established personality disorder cluster A, schizotypal. And again, would be part if there was a medical record of Dr. Frankenfooter's medical record. But beyond that, I'm not so sure it would be the focus of clinical attention. Yeah. On the other hand, if you don't really think they are psychotic, then we see some psychosis, some delusion in what is often referred to as an attenuated form, meaning that it's not a full-blown psychotic episode, whether we're dealing with delusions and or perceptual disturbances, but otherwise in some attenuated form. So bizarre beliefs, but not delusions. Some illusions, but not true perceptual disturbances like hallucinations.
With cluster A, we see it in Riffraff, the other character.
Yeah. Yeah. Other observations?
I wanted to open up before, I guess, about Riffraff. I forgot their names. And the two other women that kind of were like on Dr. Frankenfooter's side, possibly voyeurism, because they watched Rocky. Oh, they had like video everywhere, so they watched Rocky and Janet, Frankenfooter and Janet, Frankenfooter and Brad.
Listen, there was CCTV in all of those bedrooms in the first place, so the voyeuristic disorder predates any behaviors we see. The Rocky Horror Picture Show is absolutely and positively a fictional case of voyeuristic disorder. Mm-hmm. And I think all three characters, including Frankenfooter, are likely diagnosable here. Mm-hmm.
Is there anything where it's like someone, instead of like they like to be watched? Is there a term for something? Like they know, he probably knows that they're watching. He probably set up the CCTV on his own. Like, is there anything like that?
I was going to bring that up next. So there is a scene. You just heard me mention that Dr. Frankenfooter likely is diagnosable with voyeuristic disorder as well. They own the castle. Yet he or they are in bed and on the other side of the camera too, and they do appear to get some significant enjoyment out of it. To what extent does that enjoyment include the fact that they are being watched? I wouldn't dismiss it, and therefore exhibitionism or exhibitionist disorder would absolutely be the differential for Dr. Frankenfooter as well, right? So exhibitionism, which is what?
Around from exposing one's
Yeah.
genitals to
So yeah, so yeah, I was going to get to that, but yes.
Okay.
transvestic disorder.
Yeah. Yeah, I mean, the words to this song are "Sweet Transvestite." I mean, the title of the song is too. So, transvestic fetish. Absolutely. Mm-hmm.
Can you talk a bit about Frank's like gender expression
Mhm.
on that note? I was curious about like your thoughts on that.
Yeah. Well,
You have one more person here for you?
yeah, I think that number one, Frank's behavior, and number two, as much as some people may not love musicals, in that very same song, and the script itself, where we learn that our main character is from the galaxy of transsexual, the former name for gender dysphoria. I think gender dysphoria is going to be part of the discussion as well. Yeah.
Is everybody in transsexual Transylvania a transvestite?
No, because we see other characters, and this one's a tough one because I don't know exactly when they originated, because some were also created, and that may have been on Earth. So, but I think at least Riffraff is from the planet Transylvania in that galaxy, and therefore the answer would be no.
To what extent would transvestic disorder be a disorder? Can it not be like how like other paraphilic disorders, they're not fully disorders unless they impair like functioning?
Exactly right. Yep. Transvestic fetish is a paraphilia, and like any other paraphilic disorder, we have to distinguish between the behavior and the mental disorder. And that line is very clear when it impairs functioning.
This is more of a logistical question, but in treating someone with gender dysphoria, say someone wants to it was born male, wants to take estrogen or whatever, do you, for coding, in order to get insurance to cover it, you have to put gender dysphoria in?
I believe that to be the case, yeah.
Okay.
Yeah.
Is that a criteria to prescribe someone estrogen to allow them to transition?
I believe so.
Okay.
Yeah. Yeah. It's more of an insurance question, but yeah. Mm-hmm.
So that's where the age limit also comes in?
I don't know that. I'm not sure, to be honest with you.
Because when I was on Child's Life, there were parents were concerned that this is like a fleeting thought and you need to wait for...
Kids could do that, yeah. Depending on their age, sure. Yeah.
Do you have an example of when it it would be a transvestic disorder? When it would be when it would be considered a disorder?
Again, the full term is transvestic fetish. So if someone is sexually attracted to or sexually satisfied by dressing up in the opposite gender's clothes, and it impairs functioning or results in clinically significant distress, then it's transvestic disorder. If all of the above is true, but there is no impact, there is no clinical significance, then you just have the behavior in a vacuum. There's literally nothing to do.
I'm trying to think, we brought this up, I think, in the last Q&A, or one of them, it was about Buffalo Bill, I think, having this. I guess it was just significant because I think he was killing people, and then he kind of used parts of them to do that.
The other part of it too is, remember when earlier in the film when Clarice is trying to find information on the missing girl, Hannibal, as former psychiatrist, brings up that issue. So clearly there was some clinical significance, in as much as Hannibal Lecter, not the perfect psychiatrist by any means, but was treating the patient. That was for a reason. So now we don't know the details of that treatment, certainly. By the way, how cool would that medical record be? Fictional as it might be.
Are we talking about Hannibal?
Yeah, Lecter.
Oh, but there's wait, sorry. You said Buffalo Bill?
That was his former patient.
Oh, I was talking, okay, never mind.
Was there another part?
I was just going to say, I guess another, another way would be clinically significant. I guess an example, I guess, I'm trying to think, if Buffalo Bill didn't kill, I guess, was he still kind of obsessed, do you think? Obsession, do you think that would also be the clinical significance?
I'd have to look at Lecter's medical record and his progress notes. I would be fairly confident I'm going to see something there that warrants clinical significance or rises to the level of clinical significance. Remember, interpersonally, scholastically, academically, vocationally. There's probably something there.
Gotcha.
I'm just gonna say, I watch a lot of old documentaries about trans people or drag queens and stuff, and how they often say the same thing. When they were a child, they would go into their parents' closet and do it in secret. It wasn't something a long time ago. It wasn't something that they knew other people did. But I feel now with social media, we obviously know that people do that, and I'm sometimes how do you know if it's learned behavior? They learn to that.
You don't know until you meet your individual patient and you have those discussions. But whether it's learned or not, I'm not so sure that that fact matters in terms of.
About the enjoyment?
Well, I mean, it's the enjoyment, and if there's no clinical impact, why did you make an appointment to see me? On the other hand, if which usually is the case, if they present with a chief complaint and there is evidence of clinical significance, clinically significant distress, for example, then we're gonna kind of caboose the word disorder to the behavior, but only then.
But in this case, they wouldn't be sexual pleasure, it's just like.
No, it could, no, it could, no,
Just 'cause they-
no, it could be sexual pleasure.
Yeah.
No, listen, okay, listen.
In the case with like young children trying on dresses, I
You're
don't
right.
like if they're trans, then it's just because they enjoy, not in a sexual way. So it
Correct.
wouldn't, like,
So then it's not then it's not a paraphilia.
yeah,
Much less a paraphilic disorder. It's neither,
yeah.
right? So I mean, drag queens in general. I mean, they might make more money than I do per year, right? So I'm envious. If they get sexual gratification, they're going to call it paraphilia, and then if that sexual gratification linked behavior is also clinically significant, we're going to call it a paraphilic disorder. And we'll name that paraphilic disorder depending on what the object is. Is it cross-dressing? Is it inanimate objects? Is it viewing people who are unsuspecting, etc.?
So if somebody, like a person who suffers with like a paraphilic disorder, or may think that they are, is shame or like personal embarrassment enough of impairment to want to get help for it, or is that just like?
Oh no,
little
absolutely.
anxiety?
No, I mean, listen, the patients make appointments to see you for a multitude of reasons. Now, whether that reason is something that you will provide a medical opinion is something to be addressed and treated versus not is subject for discussion, right? And you're gonna take that on a case by case basis. But anxiety and depression are likely the most frequent and common presenting complaints. And unless you ask the right questions, you may not get the fact that their anxiety and depression is linked to everything that's going on. And maybe they're another Dr. Frankenfooter out in the community. So you do have to ask these questions. And of course, if you miss and you think prescribing an antidepressant is going to address their depression, boy, are you misprescribing. So you got to talk to your patients. All right, at the bottom of the hour, any other observations, any other characters you want to tackle here? I can take it as a no. All right, so I'll take this opportunity to wish everybody the best of luck tomorrow on their shelf. And we will be posting on Twitter, on X, next week's film. Just mentioned it will be The Sandlot. And we'll get the Seinfeld episode posted as well. I know this is the intern's last day too, but believe it or not, there are students that are going to be around this table tomorrow. They will get that welcome email very soon by me. So next week is The Sandlot, and we'll be in touch with regard to the selected Seinfeld episode. Thank you.